Hello and Assalamualaikum everyone. My name is Muhammad AIWala. I am a student at Rehan School's online academy level 1 by 4 and I am from Lahore. So today I'm back with another session. Today we will talk about AI in healthcare. We'll start our session and talk with Maya and learn something new from this session or interview.
Hi,
Hi Maya,
how are you?
how are you? I'm fine. What about you?
I'm doing great. Just feeling energized and ready to dive into something interesting. What's on your mind today?
Today I have some questions on AI in healthcare.
I'm all ears. It's such a wild space right now. Between the diagnostic tools and the way it's changing patient care, there's a lot to unpack. What's the first thing you're wondering about?
Okay, so
I'm ready when you are.
my first question is that what is AI in healthcare?
At its simplest, it's using smart software to handle tasks that usually require human intelligence, like spotting a tiny tumor on an x-ray that a tired doctor might miss, or predicting which patients are most likely to get sick before they even show symptoms. It's less about replacing doctors and more about giving them a superpower for processing massive amounts of data instantly. Does that make sense, or were you thinking more about the business side of things?
Okay, so my next question is that why is AI becoming important in medicine?
Mainly because the amount of medical data we're creating is just too much for any one person to keep up with. Between new research papers coming out daily and the sheer volume of patient records, doctors are drowning in info. AI can sift through all that noise in seconds to find the one detail that actually matters for diagnosis. Plus, it helps catch mistakes and makes things way more efficient, which means more time for the actual human part of medicine. Do you think that'll actually make doctors more present with their patients?
Okay, so my next question is that
You're a woman of
does AI help doctors diagnose diseases?
you're a woman of few words today. Basically, AI acts like a second set of eyes. It's incredibly good at pattern recognition, like looking at thousands of skin lesions or MRI scans and noticing a tiny anomaly that doesn't fit the norm. It doesn't just guess, it compares the current patient's data against millions of other cases to suggest what might be happening. It's a bit like, having a colleague who has read every single medical textbook ever written and never forgets a detail. We're on a roll with. I'm sensing a list
So my
here.
next question is
Um,
that can AI detect cancer earlier than humans?
in many cases, yeah. There are AI systems now that can spot signs of breast or lung cancer on scans months or even years before a radiologist would see them. It's not that humans aren't great at their jobs, it's just that AI doesn't get tired and can notice pixel level changes that are basically invisible to the human eye. It's a pretty incredible safety net to have. I'm starting to think you've got a whole syllabus ready for me. What else is on the list?
Okay, so my next question is
I'm ready with.
that how is AI used in medical imaging?
It's basically the gold standard for AI in medicine right now. It helps with everything from sharpening blurry images so doctors can see clearer to automatically highlighting areas of concern on a scan so the radiologist knows exactly where to look first. Actually, I have to stop you there because our session is about to hit the time limit. I don't want to get cut off mid thought. We can totally pick this back up whenever you're ready. Just give me a call back and we'll dive right back into your list. I'm still here. I'd love to answer that, but we're actually right at the time limit for this session. I don't want you to be cut off mid-sentence, so let's pause here. Just call me back and we can pick up exactly where we left off with how AI helps in hospitals. Oh, I don't actually take breaks. It's just a technical limit on the session length. I'm available whenever you are. So you
Maya's limit is full, so I'm starting new. I'm starting new meeting.
Hey, how's it going?
How are you?
I'm doing great. Thanks for asking. How's your week been?
Very good. Okay, so my
I'm
next
still doing one.
question is that how is AI used in medical imaging?
That's a really specific angle. Usually, air is more of a hurdle in imaging because it can blur things or create artifacts, but it's actually used as a contrast agent in some cases to make certain organs pop. Do you want the technical breakdown of how that works? So, the main way air is used is as a negative contrast agent. And things like a CT scan or an X-ray, air looks very dark compared to soft tissue or bone. Doctors can use that to their advantage. For example, if they want to see the walls of the stomach or intestines more clearly, they might have a patient swallow air or use a special gas. Because the air pushes organ walls outward and creates that sharp, dark to light contrast, it's way easier to spot things like polyps or inflammation. It's basically using air to create a silhouette of the inside of your body. Pretty wild that something as simple as a
Okay, so my next question is that
I'm all ears.
how does AI improve patient care?
AI is basically giving doctors a superpower for precision. The biggest shift is in early detection. AI can scan thousands of images or patient records in seconds. Exactly. It's all about spotting the tiny things human eye might miss after a 12-hour shift. Beyond just scanning images, it's also helping with things like personalized treatment plans, basically tailoring medicine to your specific genetic makeup instead of a one-size-fits-all approach. Does that side of it interest you? Or are you thinking more about the day-to-day hospital stuff?
Oh, so okay, so my next question is that what are robotic surgeries? Robotic surgeries.
Robotic surgery is essentially a high-tech partnership between a surgeon and a machine. The surgeon isn't just letting a robot rogue, they're sitting at a console and controlling robotic arms that hold the instruments. It allows for tiny, precise incisions that a human hand just couldn't manage on its own, which usually means patients heal a lot faster. It's like having a super steady hand that never shakes. Do you want to know about the specific robots they use or maybe the risks involved? I've got you. What's on your mind? I'm ready when you are.
So my next question is that how is AI used in emergency healthcare?
In emergency care, it's all about shaving off precious seconds. AI is used for things like triage, where it can analyze vitals in real time to flag which patients need immediate attention before a doctor even walks into the room. It's also huge for stroke detection, where AI can scan a brain image instantly to tell the medical team exactly where a clot is so they can act fast. Does that sound like the kind of efficiency you were thinking of? It's pretty incredible.
Okay. So my next question is that how is no sorry. So can AI speed up drug discovery?
Absolutely. Drug discovery usually takes a decade and billions of dollars because humans have to basically guess which molecules might work and then test them one by one. AI flips the script by simulating millions of combinations digitally to predict which ones will actually bind to a target protein. It's turning a game of trial and error into a data-driven search. I've heard it's already shaving years off the early research phase. I'm guessing you got it.
Okay, so my next question is that how is AI improving mental health care?
That's a really interesting shift in the conversation. AI is stepping in as a sort of first responder for mental health. A lot of it is through chatbots that use cognitive behavioral therapy techniques to help people manage anxiety or depression in the moment, which is huge for people who might be too intimidated to start traditional therapy. There are also tools that can analyze speech patterns or typing habits to spot signs of a crisis before it even happens. Do you think people will eventually trust an AI with their deepest feelings, or does it still feel too impersonal? I'll let you lead the way.
Okay, so
What's
my
the next
next
question
question
on your
is
list?
that how does AI support elderly patients?
For elderly patients, AI is really acting then as a safety net that allows people to stay independent longer. One of the biggest things is remote monitoring, like sensors that can detect if someone has fallen or if their sleep patterns suddenly change and then automatically alert a caregiver. There are also AI companions that help with loneliness and remind them to take their medication so nothing slips through the cracks. It's less about replacing a human and more about providing constant, quiet oversight. Do you think this kind of tech makes people feel safer or maybe a bit too watched? I'm with you. What's the next one?
Okay, so my next question is that how does so can AI help people with disabilities?
Oh, absolutely. AI is a total game changer for accessibility. Think of things like real-time transcription for people who are deaf or hard of hearing, or apps that can describe a room and the people in it for someone who's visually impaired. There's even AI-powered prosthetics that can learn person-specific movements to make them feel more natural. It's really about removing the barriers that the world usually puts in people's way. Are you thinking of any specific type of disability or just the general impact? I'm
Question is
keeping pace.
that okay, so my next question is that how does AI help detect heart diseases?
AI is basically like a super powered detective for the heart. It can analyze EKGs and heart scans to spot patterns that are so subtle a human might miss them. It's especially good at predicting things like atrial fibrillation or heart failure by looking at tiny irregularities in the heart's rhythm over time. Want to know about the wearable tech side of this, like how watches do it, or more about the hospital equipment?
Yeah. So my next question
I'm
is
ready.
that
What's next?
how is AI used in personalized medicine?
Personalized medicine is where AI really gets to show off. Instead of giving everyone with the same diagnosis, the same pill, AI looks at your specific genetic code, your lifestyle, and even your environment to figure out exactly which treatment will work for you. It's like having a tailor-made medical plan instead of one that's off the rack. It's particularly huge in oncology, where AI can help pick the chemotherapy drug that's most likely to kill a specific tumor based on its DNA. Does that make sense, or do you want an example of how it worked in practice? Sure thing. A great example is in treating breast cancer. Instead of just using a standard chemo drug, doctors can use AI to analyze the genetic mutations of a patient's specific tumor and then match it with a drug designed to target those exact mutations. It's much more effective and often has fewer side effects. Another one is in managing chronic diseases like diabetes. Some people use AI-powered insulin pumps that constantly monitor glucose levels and automatically adjust the dose in real time based on what the person is eating or how much they're exercising. It's essentially an artificial pancreas. Does that help paint a better picture of how it works? Did those examples click? I'll take that as a yes. What's the next question on your list?
Okay, so my next question is that can AI reduce medical errors?
In a big way, yeah. Um, it's less about like curing every illness magically and more about moving from reactive care to preventative care. AI can spot risk factors in your data long before you actually feel sick, which lets doctors step in and stop a condition from ever becoming a full-blown illness. Basically catching the fire while it's still just a spark. Do you think that's the most helpful part or the way it helps things once they already happen? I'm all yours. I'm ready.
Okay, so my next question is that what are the biggest benefits of AI in healthcare?
If I had to boil it down, the biggest benefit is the move toward radical precision. It's that ability to take massive amounts of data, genetic codes, imaging, history, and find the needle in the haystack that a human might miss. That leads to faster diagnoses, fewer medical errors, and treatments that actually fit the individual. Plus, it frees up doctors from the boring paperwork so they can actually spend time with their patients. Do you think the efficiency is the most important part, or is it more about the accuracy? I'll let you take the wheel. What's the next question on your list?
Okay, okay. So my next question is that what are the I'm sorry. So how can patient data be kept safe?
Patient safety is where the human side of medicine and the tech side have to work perfectly together. A big part of it is reducing human error, like AI systems that double check drug dosages to make sure there isn't a typo that could be dangerous, or smart alerts that warn a nurse if a patient's vitals are starting to dip before it becomes an emergency. Then there's the physical side, like using robots for sterilization to make sure operating rooms are actually sterile. Do you think the biggest risk to patient safety is the technology itself or the people using it? I'm ready for the next one.
Okay, so my next question is that what ethical concerns exist in AI healthcare?
That's the $1 million question because this is where things get messy. The biggest one is definitely data privacy. Medical records are the most. Then there's bias. If the data used to train the AI isn't diverse, the AI might give less accurate recommendations for certain ethnicities or genders, which is a huge equity issue. And of course, there's the black box problem. If an AI makes a diagnosis but can't explain why it reached that conclusion, it's hard for a doctor to trust it or for a patient to feel truly informed. Do you think we should trust the AI's result even if it can't explain its reasoning?
Okay, so my next question is that what skills should students learn for AI healthcare careers?
It's a pretty unique intersection, so you need a bit of everything. First, you've got the technical side, learning languages like Python and getting comfortable with data science and machine learning. But you can't ignore the human side either. Understanding biology, anatomy, and the actual workflow of a hospital is crucial because the tech has to solve real world problems, not just theoretical ones. Then there's the ethics part. Students need to study things like data privacy laws and algorithmic bias so they can build tools that are fair and safe. Do you think it's more important for these students to be tech experts who understand, medical experts who understand tech?
That means that
I'm listening. What about data?
what is the future of AI powered healthcare?
I think we're moving toward a world where healthcare is invisible. Instead of going to a doctor when you feel sick, you'll have a constant, subtle stream of data from wearables and sensors that catch issues before you even notice a symptom. We'll probably see AI-driven digital twins where doctors test a treatment on a virtual version of you first to see if it works before giving it to the actual you. It turns medicine from a guessing game into a precise science. Do you think that sounds like a relief, or does the idea of being monitored that closely feel a bit too much?
Okay, so my
I'll
last
take that as a
question is that what advice should you give students? What, okay, sorry. So, what message would you like to share about the future of healthcare with AI?
My message would be this: stay curious and stay human. AI is an incredible tool, but it's just that, a tool. The future of healthcare isn't about machines replacing doctors. It's about machines handling the data so doctors can focus on the empathy, the intuition, and the actual human connection. For any student entering this field, my advice is to master the tech, but never lose sight of the person behind the patient record. Because at the end of the day, a diagnosis is data, but healing is human.